Thank you, Presiding Officer. Can I ask the First Minister if she has full confidence in her government's NHS recovery plan?
First Minister.
Yes, I do, but the Government will continue to work hard to ensure that the recovery plan continues to develop and evolve and be fit for the purpose of getting the NHS through the remainder of COVID and onto a path not just of recovery but of sustainability for the future. Audit Scotland, of course, has this morning published its regular review of the NHS. I welcome that report. It is a challenging report, but it is also fair and balanced. It recognises that the task that all governments face to recover their health services from COVID is a difficult one and there are no easy answers. But the Audit Scotland report also, I think, fairly recognises the work that the Government and the NHS has done throughout COVID and as we now enter into recovery from COVID, and indeed recognises the plans that the Scottish Government is now implementing with the NHS to ensure that sustainability for the future.
Douglas Ross.
Yes, I do. 3 simple words from the First Minister confirming that everything she's put forward in her NHS recovery plan has her backing. It's what she believes is the way of getting our health service out of the struggles of the pandemic. Yet it's a very different view from Audit Scotland, who have said this morning quite a damning verdict on the Government's plan to rebuild Scotland's NHS. It states, and I quote, "There is not enough detail in the plan to determine whether ambitions can be achieved in the timescales set out." Not enough detail in the plan that the First Minister just moments ago said she's happy with. So will the First Minister now accept that the recovery plan doesn't go far enough and urgently needs to be redrafted to address the serious concerns that have been highlighted?
First Minister.
No, I don't agree with that. I do, however, agree, and I said this in my initial answer, that as the Government we must ensure the implementation of that recovery plan, and we must ensure that that recovery plan is flexible and adaptable to make sure that it is fit for the very significant challenge that Scotland faces, and indeed countries across the world face, in recovering their health services from the pandemic. I think the Audit Scotland report today is very fair, very challenging, but I also think, and people can go and read it for themselves, it sets out and acknowledges the work that is underway. So, for example, on just page 3 of the report, Scottish Government plans have the potential to help the NHS become sustainable. Later on, the Scottish Government recognises the risks relating to workforce capacity and well-being are significant. It has introduced a range of controls to mitigate those risks. The Scottish Government and the NHS are implementing lessons learned from the pandemic. The Scottish Government plans for recovery and redesign of NHS services are ambitious, although of course it goes on to say that they are challenging, and the NHS has implemented a range of new ways of working to improve access to healthcare services. So that recognises and records the work that is underway. Finally, Presiding Officer, I would simply note that we are investing record sums in the National Health Service, around, I think, just over £100 per head more than equivalent investment south of the border, which equates, I think, to £600 million more being spent on the NHS than would be the case if we were following the investment of the Government at UK level. There are also record numbers of people working in our National Health Service. So I recognise the challenge. This is perhaps one of the biggest challenges that faces us and other governments, but it is one that we are focused on, that the recovery plan will help us address, and we will continue to ensure that it and the resources that back it up are fit for the scale of that challenge.
Douglas Ross.
I noticed the First Minister picked elements of the report that were positive for her government, but failed to address the actual substance of my question, which was about the lack of detail, not enough detail in the report, and the lack of clarity on the timescales that need to be met to reach the ambitions that are set out. And the First Minister also mentioned workforce and record numbers, but the report makes it plain that the recovery plan will fail unless the Government recruits enough people with the right skills. It highlights vacancies at record highs throughout the health service. Scotland's NHS staff have gone above and beyond throughout the pandemic to keep the public safe, but they're now stretched to their limit. Today, on top of this damning Audit Scotland publication, there are reports of junior doctors exhausted, burnt out and even leaving Scotland to work in health services elsewhere. First Minister, how will your plan to cut down waiting times actually achieve the desired outcomes when staff are at breaking point, or worse, preparing to leave our NHS?
First Minister.
Well, first of all, we have record numbers of staff working in our National Health Service, and those numbers, of course, don't include vacancies. These are staff in post. But we recognise the recruitment challenges. That is why Audit Scotland actually recognises this point. We are investing in the well-being of staff, as well, of course, as investing heavily in recruitment. But Douglas Ross suggested that I had selectively quoted Audit Scotland report. I absolutely am clear that it is a very challenging report and there are real lessons in it for the Scottish Government, but it does fairly recognise the work that we have been doing. But on the topic of selective quoting, here is what the Audit Scotland report says about staffing. The UK's departure from the EU will further reduce the pool of workers available in future years. And that is also one of the realities exacerbating the recruitment challenge that perhaps Douglas Ross might want to respond to and reflect on when he next gets to his feet. These are big challenges. That is why we are meeting them with investment, with support for staff. And in terms of the detail in the recovery plan sets out our ambitions. It sets out the broad plans that we will implement to meet those ambitions. But of course, we have also asked, and they will deliver them next month, health boards to produce detailed implementation plans so that the detail of implementation is there and then we then scrutinise and hold to account. Nobody should underplay the scale of the challenge that countries everywhere face in getting their health services back on track. But we are supporting the health service with investment, we are supporting staff, and we will be focused on ensuring that our health service recovers and is firmly on a path to sustainability for the future.
Douglas Ross.
The Audit Scotland report lays bare that Scotland's NHS is on an emergency footing. And new evidence submitted this morning to the Parliament's COVID Committee spells out the true cost of this government's failure. The Royal College of Emergency Medicine have said that delayed A&E admissions in Scotland led to over 500 excess deaths in 2021. They state those avoidable deaths are, and this is a direct quote from evidence to the committee this morning, entirely attributable to the delay to admitting these patients' experience. 500 lives lost because the government didn't act early enough, despite receiving warning after warning that Scotland's NHS is in crisis. So, First Minister, if the Audit Scotland report isn't a wake-up call for you and your government, surely these deaths must be.
First Minister.
I know Douglas Ross probably scripted that before coming into the chamber, but anybody listening to me will hear me taking very seriously the Audit Scotland report, the challenge it poses, the challenges that our NHS faces, which are in common to challenges that health services across the world face. But they will also have heard me set out which is recognised in the Audit Scotland report. And people, of course, can go and read the report for themselves. They don't have to take either my word or Douglas Ross' words for what it says. But it recognises the work that the Scottish Government is doing. It absolutely rightly questions the detail of that work, and it says that our ambitions are challenging, will take time to deliver, and the Scottish Government, as it always does, will pay very close attention to the recommendations it makes. In terms of accident and emergency, and I take all of these comments seriously, of course the NHS is and has been on an emergency footing. It would have been unthinkable for it not to have been on an emergency footing, given that we have faced the emergency and the crisis of a global pandemic. And the consequences of that for our NHS and for people waiting for care has been severe, and I recognise that. But if we look at A&E on its own, big challenges there for us to confront, absolutely big challenges. But our A&E units are still the best performing anywhere in the UK, have been for 6 years in a row. We have invested in staffing in our accident emergency units, in redesign to ensure that only those who need emergency care access it in that way, and they get quicker treatment. So I don't shy away from the challenges here. This is a massive challenge for us and for governments everywhere, but it is one that we are addressing with resources, with support and with the absolute focus that people have every right to expect us to do.
Question number 2, Anas Sarwar.
Presiding Officer, today's Audit Scotland report paints a devastating picture of the state of Scotland's NHS. It details out-of-control waiting times that are, in their words, ever-increasing, a workforce that is burnt out, burdened by stress and strain, with 61% of nurses saying they are thinking of leaving their job because they are undervalued, and a system that is financially unsustainable. The impact on patients could be devastating. As the report says, health conditions will go undetected for longer, leading to potentially worse outcomes for people. First Minister, after 15 years in power, how did it come to this?
First Minister.
Anas Sarwar is possibly the only person that hasn't noticed that we have been in a global pandemic for the past 2 years. I think people across the country understand the reasons for the pressures that Scotland's National Health Service is facing, that England, Wales and Northern Ireland's National Health Service is facing, and that health services across the world are facing. I take those pressures seriously. The Audit Scotland report has got a lot of positive things to say about how the Scottish Government and the National Health Service responded to the pandemic, how we prepared for this very challenging winter. And of course it does recognise the steps that we are taking to put the NHS on that path to sustainability, but it poses serious and challenging questions for us, as it has every right to do and every responsibility to do. But Anas Sarwar wants to look back over the past 15 years, and in the NHS I am more than happy to do that. So if we look, for example, at funding in our National Health Service, since this government took office back in 2007, funding for the health portfolio has increased by over 90%. Frontline health spending is 3.6% higher per head in Scotland than in England. That's the more than £100 per head that I referenced earlier on. That is, if you total that up, equivalent to £600 million, 14,000 nurses. Staffing, NHS staffing, since this government took office, up by over 27,000 whole-time equivalent staff members. That's more than 20%, and again, that doesn't include vacancies. So we will continue to face up to these very, very real challenges. We will do that with investment, we will do that with support, and we will do that with determination and focus.
Anas Sarwar.
The First Minister wants to pretend these problems have all been created by COVID, but that is not true. Scotland's NHS was in crisis before COVID hit, and that's why we are struggling to recover. Here's a reminder of what was happening before COVID. Audit Scotland report 2017, 99% increase in people waiting more than 12 weeks for an appointment. Audit Scotland report 2018, Scotland's NHS performance continuing to decline. Audit Scotland report 2019, Scotland's NHS financially unsustainable. Year after year, the worst reports in the history of devolution. First Minister, how many more devastating reports do you need before you act in the interests of patients and staff?
First Minister.
Well, I don't pretend that all of the challenges facing our NHS or other health services are all down to COVID. The health service has been facing demographic pressures. It has faced the pressure of a decade of Tory austerity, started actually under the last Labour government, in case we forget that point. But what was happening before COVID, our waiting times improvement plan was making progress. Was reducing the longest waits in our National Health Service. But I don't pretend that. But Anas Sarwar wants to pretend that COVID hasn't had a significant and very significant impact, and he somehow wants to pretend that these challenges are unique to Scotland's National Health Service. These are challenges being faced everywhere across the world. This government is investing more than many other governments in our health service. We are doing a range of different things to support our health service, and we will continue to do exactly that for the sake of those who work on the front line, but also for those patients who rely on its services.
Anas Sarwar.
The First Minister's response is, frankly, nonsense. 680,000 people waiting on an NHS waiting list. That's 1 in 8 of the population. That was 450,000 before the pandemic. 1,000 NHS beds short. The First Minister cut beds before the pandemic. 3,500 nurses and midwives short. The First Minister cut training places for nurses and midwives before the pandemic. Staff and patients crying out for help, and a First Minister who responds with empty rhetoric rather than practical action. This government has been solely responsible for Scotland's NHS for 15 years. The result? Staff burnt out and wanting to leave, and patients failed and languishing on waiting lists. This SNP government has put Scotland's NHS at risk. How can they be now the ones to save it?
First Minister.
Well, people in Scotland, of course, make those verdicts and decide who they trust to steward our National Health Service through difficult times and onto the path to recovery. Let me take the two issues Anas Sarwar raised. Firstly, on bed numbers. We do have to reflect on the bed numbers we will need as we come out of a COVID pandemic and face the likely challenges that COVID will present over the years to come as it hopefully becomes endemic. But Anas Sarwar is from a sedentary position, saying we've cut them. Bed numbers have been reducing in Scotland and countries across the world for many, many years because of advances in treatment, because many people who used to go into hospital for things like cataracts now get those treatments in a day-case basis. And let me just remind Anas Sarwar, and he can go and check this, and anybody can go and check this, under the last Labour Liberal administration in this Parliament, bed numbers fell every single year, reflecting, and Andy Kerr, who used to be Health Secretary, used to stand here and make the same argument that I have just made about advances in treatment and technology. Of course, looking ahead, we need to address that. And then look at staffing. Look at nurses, for example. I don't underestimate the challenge that our nursing profession works under. But in Scotland, where we have 8.4 qualified nurses and midwives per 1,000 population, compared to just 6 in England, 40% higher staffing levels in terms of nurses and midwives. So are there challenges in our health service that we have to confront and support the NHS through? Absolutely. But we're providing the investment, the support and the focus and determination. That's the trust the people of Scotland have put in this government, and we will get on with that job.